Hello, this is Bethany, and I'm presenting my motivational case study for clinical teaching methods. As an introduction, the purpose of this case study is to identify learning needs and teaching strategies for an individual student in a local dental hygiene program. The subject and setting, we're focusing on a student whose name is Anna. She's 22 years old. She's a single Caucasian female, and her educational background consists of 2 years of college prerequisites that she completed prior to getting admitted to her local dental hygiene program. The dental hygiene program is the place where this is all happening. She's taking place in her first year clinic as part of clinical practice of dental hygiene. Just a little bit of information about Anna. She's in the middle of her first year as a dental hygiene student. At the beginning of her educational experience, she was enthusiastic about learning. She maintained excellent grades and was outwardly excited about her goal of becoming a registered dental hygienist. Recently, however, Anna has been struggling. Her clinical proficiency grades have been steadily declining, and her attitude is not as positive as it once was. Students and instructors have witnessed her losing control of her emotions on a more frequent basis, and it is clear that she is questioning her future in the program. The main problem that I noticed here is that Anna appears to be specifically struggling with basic hygiene instrumentation concepts. When asked, she is able to recite proper technique but fails to put them into practice when she utilizes the instruments intraorally. After performing poorly on multiple clinical proficiencies, Anna's self esteem has drastically declined and affected her ability to learn new information. Some important areas of opportunity that I noticed were skill mastery, integration of theory and practice, and communication. A plan that I put together to help her with some motivational strategies consisted of demonstration. That's something I found in the textbook, and it focuses on a show, tell, do approach, which we learn a lot about in dental hygiene school. The instructor models proper technique that the student can visualize and repeat. Another concept that I would use is listening. Again, I found that in the textbook. And there's a concept called perception checks that allow the instructor to paraphrase students' feedback to improve miscommunication. And instructors can bring attention to negative attitudes that the student may not be aware that they actually have. Another concept that I would be using is called journaling. It's also in the textbook, but I found another source that I really like the way that they describe this idea. It allows students an opportunity to reflect on their clinical experiences, and it brings awareness to feelings and areas of improvement. I also would utilize skill review sessions. Um, this talks about replacing a clinical day or offering a tutorial period where students can rotate through stations and practice basic clinical skills. And it provides extra opportunities for students to receive direct feedback from instructors on their technique. The last concept I would be utilizing is praising. That's another one that was in the textbook, and it just involves positive comments to affirm students that they are meeting or exceeding expectations. And it's important that students are not praised without merit. It should always be earned through successful performance. The projected results that I would have for implementing these strategies would be number one, that Anna gains an awareness of her attitudes and feelings toward hygiene clinic and techniques. So, a lot of our beliefs and the way that we think about things ultimately predict our behavior and the results that we get. So, focusing on her attitude would be the most important thing. The second result that I would have is improved instrumentation and the ability to apply theory to practice. And the third result that I would be having a goal of obtaining is Anna's clinical confidence being restored. Thank you for listening to my presentation. I appreciate you taking the time. I do think that we learn best together. Have a great day.